Hey everybody, Dr. Hilinski, San Diego, California, facial plastic and reconstructive surgeon. I wanted to talk to you today about the main differences between otoplasty and macrotia ear reduction. Otoplasty is classically the procedure that people think about when you're thinking of cosmetic ear surgery just because it's so popular. These are patients that have prominent ears, they stick out too far, they do come in complaining that their ears are quote unquote big, but when you look at the ears, they're actually sticking out too far. It's usually a reflection of the conchal bowl, which is the round part of the ear, the cup part of the ear that extends into the opening. That's considered too large. That's one component. The second main component is the lack of an ear fold. We call it the anti-helix in terms of medical jargon, but it's really the fold that is missing in these patients' ears. You look at these ears and you see essentially a flat area across what we call as the scapha. Combined, these are the two main components of patients who are seeking otoplasty or ear pinning. In this instance, we have to reduce the size of the conchal bowl and we have to create an ear fold, and that brings the ear closer to the side of the head. In doing so, it doesn't really make the ear smaller. It just moves its position. It reshapes it, yes, but it doesn't make the ear smaller. It appears smaller, and that's why when patients look online and they search for smaller ears, they see advertisements and hits for otoplasty or ear pinning, but it's actually not really the case. The only thing that makes an ear smaller is macrotia ear reduction surgery. That's what I've become most famous for across not only the United States, but now internationally. We have a variety of patients that have found us from all over the world that travel to San Diego to have their ears made actually smaller in size. This is the only procedure out there that is going to help make your ear truly smaller from top to bottom. And in doing so, I take the top part of the ear, I reduce it in size, I recreate a natural curvature to the ear, and then I also will reduce the size of the earlobe. So from top to bottom, I can make an ear smaller in size, not just pinning it, but making it truly smaller in size. Well, what about how far it sticks out? What about the ear being prominent from the front view? Patients ask this all the time when it comes to macrotia ear reduction. Do I need to have otoplasty at the same time? Well, in some cases, yes, but that's pretty rare in my practice. In my experience, I'm able to bring the top part of the ear in at the same time that I'm making it smaller, so it almost looks from the front view like I did otoplasty, but I didn't. I'm actually making the ear smaller in size, and in doing so, we get this byproduct benefit of it coming in from the top. But this is the main difference between what otoplasty does and what macrotia ear reduction surgery does. I hope this was helpful for you. I hope anybody out there considering cosmetic ear surgery looks very closely at my website, looks very closely at my body of work, and realizes there's a reason why a lot of patients call me the king of cosmetic ear surgery.